let's read this together and make sense of a few things here. Okay, 70-year-old. Okay, remote history of TB. This is very important. So 70-year and TB together. Okay, worsening abdominal distension, bilateral ankle edema, progressive exertional dyspnea. So there is fluid edema happening almost, like all over sort of lungs and systemic. You see that on physical exam, JVP is elevated. Okay, that tells us definitely something is going on the right side of the heart. Okay, increases further with inspiration. Okay, heart sounds are distant, and an early diastolic high frequency sound is just heard after S2. This, if you are good at heart sounds, this gave us a lot of information. So ascites, hepatomegaly. So again, fluid. Is this telling you about some sort of heart failure? Yes, it is. Okay, back pressure is building up, ascites, hepatomegaly. So it's building up, and it started with 70-year-old with TB, history of TB, something that triggered this, and then ascites, lungs are clear. Okay, so which of the following best explains the pathophysiology of his cardiac findings? So we have 5 lengthy options. Let's read. Impaired right ventricular filling due to rigid pericardial layer, severe tricuspid regurg leading to systolic uh, flow reversal, fixed left ventricular outflow obstruction by septal hypertrophy, immune complex deposition in endocardial surfaces, and continuous left to right shunt across ductus arteriosus. So I would not want to ignore the 70-year-old with the history of tuberculosis. Okay, so and then something heard after S2, right? So high frequency sound heard after S2. I have that sound. I'll share that with you today. Okay, it's very interesting. So the correct answer here is this pericarditis has happened. Okay, again, you see how important this pericarditis topic is in cardiovascular inflammation. So this is another important topic. We talked about MI pericarditis. Now this is uh, chronic inflammation because of TB causing pericarditis. That is the situation that has happened here. As a result of chronic inflammation because of TB, tuberculosis, what has happened? The heart pericardium, this pericardial layer, has become inflamed, and as a result of ongoing chronic inflammation, okay, it has become fibrotic. Okay, so chronic inflammation, granulomatous inflammation, okay, it does lead to, okay, fibrosis. You remember again chapter number 2. So let's look at this. So clinical history had TB, raised JVP, that rises with inspiration. So this is called Kussmaul sign. Again, another important topic from your physiology. You remember this? So early diastolic knock. This is another question. This diastolic knock is what is present in our patient. Okay, and I have a video and I'll share this with you because this is very very important. Okay, so this is causing the heart failure, and heart is basically now constricted. I'll show you some pictures. So because of this inflammation, heart is basically constricted and it cannot expand. If it cannot relax or it cannot expand, enough blood cannot go in. So it's looking as if this is constrictive type of pericarditis.